Hello again. Now we are on Trach compressors, high flow compressors, 50 psi, whatever verbiage is used. It's the same thing. This is for a patient that has a trach. And a trach is a tube that goes into their throat. Or if they just have a stoma, the hole that's in their throat, and they need to add some moisture. So we're going to do troubleshooting with this. One of the first things that you need to realize is that the numbers on the top of any of the water bottles, these neb bottles, does not determine how much oxygen the patient's getting. In the home setting and in some facilities, they are not using wall oxygen like is in the hospital. If we were in the hospital, yes, I would set this, point the little arrow to whatever oxygen flow I wanted. But in the home setting, or again, in some long-term cares that don't have piped O2, all this does is determine how much of a mist we have. So normally, what we do is when the technicians come out, the gauge on the compressor is set at 40. The number here is set at 40. And then if they're on oxygen, the oxygen is set at 4. The oxygen can be turned up and down by nursing or family, whoever is administering that oxygen. That's just an easy way for us to set it up so everything gets set up the same way. So it's 40, 40, and 4. We use distilled water in our nebulizer bottle. And then if you're having oxygen, the oxygen is hooked up right here. And I'm using blue tubing, which is normally what you'll see. We also have the white tubing, just to make it easier for you to see as I'm doing things. So we have our bottle set at 40, and then our oxygen. We have our tubing, and then this is our drain bag. And the drain bag is for the condensation, that's the rain out that we're having in the tubing. The drain bag should always be at the lowest point. Then we have another piece of tubing. This is our valve T adapter. This is so we can get breathing treatments in line without having to take everything off of them and hooking up to a breathing treatment. Then we have a short piece of tubing and our trach mask. So when we turn it on, we want to make sure we have adequate mist coming out of the end. So how we determine what's adequate is when they inhale, you want extra mist, and that provides sufficient humidification to their lungs. So again, the mask goes around the trachostoma, and your person is all set. If we're doing a breathing treatment, then you uncap this, your medicine cup hooks to the bottom, your tubing goes to your nebulizer machine, you turn on the nebulizer, you turn this machine off. So all they're getting is their medication, is what they're breathing. If they're on oxygen, they're still getting their oxygen through the tubing to the mask. But now they can get their aerosol treatment. When the aerosol treatment is done, you take the medicine cup off, you cap it. All right, now we're going to do a little bit of troubleshooting. If you call and you say, the water bottle's not making mist, a couple things have happened. Sometimes you have trouble getting this screwed on straight. So you have to take it off and redo it, and take it off and redo it, and take it off and redo it. Sometimes the bottle's not screwed together correctly. That can happen. It happens more often than not if we have a problem. And again, depending upon who you're getting your supplies from, the top might be a little bit different, but they all have numbers on them. Now, I have no mist. My bottle's screwed together, screwed on good here, it's screwed on there. Everything is good, except I'm missing a piece. And I will show you. Again, this is a nebulizer bottle. not a humidifier bottle. It does not bubble, but it doesn't have the straw. This one, the straws come out. So it has to have the little straw to force the air down into the water bottle to make the mist. And again, you have to make sure that it's screwed together correctly. And it's put on here correctly. And sometimes you want to yell at something, yell at the bottle, not at people around you. And we have mist. If you feel that you're getting too much mist, please contact your nurse or contact respiratory so that we can figure out exactly what's going on. But again, you want sufficient mist so when they inhale, you have extra mist. And again, this would not be at their face, this would be around their neck. Thank you.